working for her. Hold on one second. Zoom not working for me. I've been on Zoom calls all morning, so I don't think it's on my end. So, let me ask her a question. I'm going to ask her if I can give Danielle her cell phone.
Sounds
So
good.
Can you help her, maybe walk her through it, see what's up? So Danielle, I just texted you her cell phone number. If you can reach out to Mayor Concannon and see if you can help her out. Thanks.
Will do.
All right, just a heads up for everybody. We are now live on YouTube. We'll get started in just a few minutes after Danielle is able to talk with Mayor Concannon. So a couple more minutes, everyone. Thank you.
No. Okay, let's get this beautiful blank background.
All right. Hi, Mayor Concannon. We can see you and hear you. Thank you.
Okay, thanks. I don't know what happened. My computer stopped wanting to do Zooms. I don't know why, but I switched.
Technology is fun.
We're resilient and adaptable, so here we are.
You got that right. Thank you.
Mhm.
Okay. All right, everybody who is speaking, if you can turn your cameras on, I'll go ahead and start letting the media in, and then Amy will kick us off.
All right, welcome everyone. We're going to go ahead and get started. My name is Amy Delinky. I'm the Substance Misuse Response Coordinator with the Knox County Health Department. And I want to thank you for joining us for the virtual release of the All4Knox strategic plan. All4Knox was started as a joint initiative between both our city and county mayor to address substance misuse. So I want to thank both Mayor Jacobs and Mayor Concannon for their efforts and for being here today. And at this point, I'm going to turn it over to Mayor Jacobs to get us started and kick us off.
Well, thank you very much, Amy, and I appreciate all of your efforts and everyone else who's involved with All4Knox. When we look at the drug and opioid epidemic, and I say drug and opioid because it's bigger than just opioids, it is an enormous problem, especially here in Knox County and in East Tennessee. Until this year, we had seen an increase in death by overdose, which had started to decline last year, but now it has gone up again. I think a lot of that due to the COVID-19 pandemic. But we also have to keep in mind that we have much more aggressively deployed Narcan with overdose victims. So I think that saying that we have, been able to turn the corner on overdose is really that's not a fair statement to make. I think that when we're looking at death by overdose, that Narcan has really been able to help in that area, but the underlying problem with addiction hasn't gone away. In fact, it's gotten worse. And I appreciate everyone's efforts. We've done other things as well, working with the faith-based community and having them involved. And it really is going to take an integrated effort from the entire community. This is a huge, huge problem. And it doesn't affect only the people that are directly impacted, of course, addicts and their friends and family. It affects all of us because when we look at the economic impact across the state, it's $2 billion. When we look at the impact on our youth and the generations coming up, that's enormous as well. One of the extremely sad statistics is the amount of money that is spent in regards to babies who are born with addiction. It's not only, of course, the amount of money, but that's just a metric to show, individuals, infants, newborns who have done nothing, of no choice of their own, who are born addicted to opioids, and that continues to be a problem. But nevertheless, through organizations and efforts like All4Knox, Metro Drug Coalition, and others in our community, we are aware that this is a problem, and I think that's the first step, and we are addressing it. So I just want to thank everyone so much for all of their efforts, the All4Knox folks, the health department, Metro Drug Coalition, our partners in the private and the nonprofit sector, and I look forward to working with you all and continuing to address the drug and opioid epidemic here in East Tennessee and specifically Knox County.
Okay, I think I'm going next. I don't know if there's some MC in between, but
and now American Cannon.
Yes, thank you, Mayor Jacobs. Mayor Jacobs, appreciate you kicking us off, and I agree with you wholeheartedly that this is a community-wide effort that's going to take a community-wide moving from concern and caring to action. So substance misuse is a huge challenge in our community and has been for many years. And I'm grateful for the many people who've worked on this plan. It's a really comprehensive plan, and it covers a lot of different elements and also, most importantly, a lot of different strategies for what to do next. Because I know the people of Knoxville and the people of this community understand the seriousness of this issue, and they're ready to move to what are the strategies to address it. So I know my predecessor, Madeline Rajero, was the mayor when this initiative kicked off, and I'm grateful that she was part of it, and I'm all on board, and so is the city of Knoxville to continue this effort. As people at the health department know more acutely than anybody, the COVID-19 pandemic has made things harder for a lot of people, including those suffering from the brain disease of addiction and substance misuse. The pandemic has also revealed the huge gaps that we have in access to mental health care and drug treatment. So I'm really pleased that this plan highlights our collaborative effort to address the community's pain and suffering associated with the opioid crisis. This drug addiction and substance misuse for opioids and other drugs impacts people of all ages, all backgrounds, including the babies that Mayor Jacobs was mentioning. So we all know family members, we all have friends who've been affected by this. It's painful, and we can and must do better. So we've come a long way as a community in overcoming the stigma. And now the community is ready for measurable goals. And that's what I think this plan contains, is measurable goals. I also want to just say, as city mayor, I am so proud of our first responders, the police department and the fire department. They are doing a really good job responding to emergency overdose calls. And I know that this plan can help us move from the emergency response to treatment and counseling. And prevention is ideal, but when we have people already suffering from this brain disease, we need to be a community that truly supports recovery for the many people who are suffering with addiction. So thank you to the health department, Amy Delinky. You've done a great job, stellar work in the middle of also dealing with the pandemic response. Thank you to the Metro Drug Coalition and all the city and county leaders who've been involved with this. I will now turn it over to Dr. Buchanan for her comments and overview.
Thank you, Mayor Concanon, and thank you, Mayor Jacobs, and thanks everybody from the community who's joining us. And I'm really appreciative of our partners who've stayed committed to this cause. And we know the pandemic has kind of sidelined a lot of us and made it harder to stay focused on other things other than the COVID-19 crisis. But I'm incredibly proud and appreciative of all of you who've remained committed to this endeavor and worked diligently over the last several months to get this plan finalized. It was a heavy lift. And I want to especially thank our own Amy Delinky for her dedication and work as she continued to do with creating this plan and implementation of this plan. We know, as the mayors have stated, this year's been really challenging for everyone, especially those with substance use disorders. I want you to know that the Knox County Health Department will continue to remain committed to addressing the epidemic of substance misuse by reducing stigma, linking folks to care, and convening stakeholders such as you to work together to tackle this issue head on. This effort will take community buy-in, as Mayor Jacobs talked about. We continue to encourage people to look in their own lives, at their jobs and their friends, and see what they can do to impact the problem of substance misuse in our community. And to look at this plan, because this plan has something for everybody. That's why a 3-year plan is so important. Everybody can look at this plan, I believe, and say, I can plug into that, or I can do that. So it gives people actionable steps and things to do rather than to wring our hands and just say, oh, we have a problem. We're now taking action. And I'm really proud of us as a community for doing that. In a few minutes, Amy will join us to talk about the plan and the next stages, including implementation and how folks can get involved. But for now, I'll turn it over to my friend and colleague, Executive Director of the Metro Drug Coalition, Karen Pershing. Karen.
Thank you, Dr. Buchanan. This is really an exciting day. We've all been anticipating and waiting on this plan to be released. And so I can say from the Metro Drug Coalition's perspective, we are grateful that everyone came to the table in August of 2019, willing to roll their sleeves up and to dig in and to really, as a community, come together around this issue. And so creating that community collaboration is really what it's going to take to really move the indicators and to get people moving in the same direction to create what we call collective impact. Because no one organization or no one entity can do this on their own. And that's what's great about this plan, as Dr. Buchanan stated, is that there is something in this plan for everyone. Whether you're a stay-at-home mom, whether you're a business leader, whether you're a healthcare provider, first responder, a government leader, judicial system, again, all of us can play a role in reducing substance misuse and the impact that it has on our community. So some of this too, you're going to see that there are overlaps in the sectors and what those sectors came up with as their strategies. So I think what you'll see is opportunities for cross-sector collaboration, which is going to be really, really important too, because we all tend to work in silos, but we've got to break down those silos and be able to communicate with each other in order to help those who are being affected by this disease. So just really, really excited, and again, appreciate all Amy's work in leading this process, and look forward to this action phase and being, again, rolling up our sleeves and being feet on the ground and seeing what all we can get done. So now I'm going to turn it over to Amy Delinky and let her talk a little bit more about the plan. Amy?
Thank you, Karen. So I really wanted to start with the vision of All4Knox that's outlined in the strategic plan to reduce the impact of substance misuse on our community. And it's been an incredible experience to work with so many community stakeholders, really invested in creating long-term, community-level, sustainable solutions. And through this process, we've worked with 9 different sectors who really worked to write this strategic plan based on what it was that their respective fields could do, all while getting the sector leads together and finding opportunities for that cross-collaborative work. But this really is just the beginning. This strategic plan allows us a framework to move forward with as we move into implementation. At this point, anyone in the community can access the full strategic plan on the All4Knox website, which is all4knox.org. On the website, folks can also sign up to become a part of an implementation team and to really get engaged in this next piece of the process. The work doesn't stop here because we have this document. This is really when the work begins. And so, as everyone else on here today has stated, there's so much more to be done, and there's so much that's already happening. And so this plan really gives us a snapshot of the work that was already taking place in different ways that we can all tie in with existing work. And that allows us the opportunity to see where the new work can begin. So working with all these stakeholders over this last year, it's been amazing to watch the amount of time and effort and dedication that our community has really committed to addressing the issue of substance misuse. And I especially want to thank our sector leads. We had 2 to 3 folks that really led and would guide each sector through this whole process of the last year. And I want to thank them for volunteering so much of their time and energy. So at this point, I would like to play a video that has some of the sector leads in it, explaining why this process is so important to them.
Hi, I'm Kelly Drummond, and I work for the Boys and Girls Clubs of the Tennessee Valley. I'm All4Knox because when we work together, we are creating a better community.
I'm Charme, Knox County District Attorney General, and I'm All4Knox because everyone deserves to live in a safe and healthy community.
Hello, my name is Whitney Cooper, owner of Volunteer Drywall. I'm All4Knox because I want my employees to return home safely to their families every evening.
Hi, I'm Eve Thomas, the Chief of the Knoxville Police Department. I'm All4Knox because opioid addiction does not discriminate. It affects us all, and we all need to be a part of the solution.
My name is Keith Gray, and I am the Chief Medical Officer at the University of Tennessee Medical Center. I am All4Knox because I believe that Knoxville cannot be its best until everyone has the opportunity to be spiritually, physically, and mentally healthy.
Hi, I'm Randy Boyd, President of the University of Tennessee, and I support All4Knox because there is no greater crisis facing America, facing the state of Tennessee, and facing Knox County than the opioid and addiction crisis that we have. We must all pull together to solve and end this crisis once and for all.
Hello, this is Vivian Shai with I Am the Voice of the Voiceless, and I support All4Knox because we are working together to remove the stigma of substance misuse and save lives, as we recognize it is a disease that can be cured.
This is Tom Bevins, resident agent in charge of Knoxville, Tennessee DEA, and the supervisor over DEA 360. I am All4Knox for the partnerships we have formed with the community and that we are saving lives.
I'm Jerry Askew, president of the Alliance for Better Nonprofits, and I'm All4Knox because substance misuse destroys families and affects all of us.
So again, I want to thank those sector leads for really supporting this process and giving so much of their time and energy, as well as really being the ones to assist in creating a lot of those cross-collaborative efforts. So at this point, we are ready to take questions from our media partners. For the media, you're welcome at this point to now unmute yourselves and turn your videos on if you would like. Since we have so many speakers today, when it's possible, if you could address your questions to a specific individual, we would appreciate that. Thank you.
Hi, I have a question.
Go ahead, Jesse.
Hey, so I was just wondering, and this is really for anybody, and some of you touched on it, but if you could talk a little bit more about the effects of the pandemic that you are all seeing on opiate use, addiction, overdoses, and so forth, because I know both locally and nationally, it looks like some of the advances that were made over the last couple of years have maybe kind of backslid during all of this.
Karen, can you maybe speak to that?
Sure, Jesse, I'll be happy to respond to that. It's something that I've been tracking, the suspected drug overdose death rate since the pandemic started. During the stay-at-home orders, we saw a pretty significant increase in drug overdose deaths. And overall, for the year, we're about a little over 20%. It varies between 20 and 23%, depending on when I check it. But the last time I checked, it was around 22%. We're starting to see it level off, I think, because more services are coming back online, more face-to-face, which is really what people who have a substance use disorder really need, is that personal connection. And so being able to have recovery support meetings that are now live, face-to-face, using social distancing and wearing masks and following the CDC guidelines and doing it safely, but just being in the same room with people, I think, is having a huge impact. And so we're starting to see those numbers level off, which is a good thing. But like Mayor Jacobs said, we do have a lot of naloxone that is being distributed in the community, and our overdose death rate would be much higher if it weren't for first responders carrying naloxone, as well as lay persons who are also getting it from Metro Drug Coalition and other agencies out there who are providing it free of charge.
Any other questions? All right, if there's no other questions, thank you for everyone for joining us on this virtual release call. And I especially want to thank Mayor Jacobs, Mayor Kincannon, Dr. Buchanan, and Karen for being here and for all of your leadership and support throughout this process. Thank you guys for giving our community the opportunity to continue addressing this problem together.
Thank you.
Thank you.
Thank you, Amy.